What's up, Medite here, and in this video we'll be covering the muscles you'll find in the region of the thigh, which, as you know, are a part of the muscles of the lower limb. So the muscles of the lower limb are divided into 4 parts according to their anatomical location. The first group are the muscles of the hip joints, then we have the muscles of the thigh, muscles of the leg, and then we have the muscles of the foot. So again, muscles of the thigh are what we're going to focus on today, and they're divided into 3 main groups based on their anatomical location. We have the anterior group, which consists of 2 muscles. We have a medial group of 5 muscles, and a posterior group of 3 muscles. So let's work our way through all of these muscles here, starting with the anterior group. Okay, so the muscles of the anterior group cover the entire anterior surface of the thigh. They're big muscles, and they all have one thing in common, which is that they're all innervated by the femoral nerve. So first, we have the Quadriceps Femoris, which is the main muscle group of the anterior region of the thigh. And the reason why I call this muscle a muscle group is because it consists of 4 parts that originate at different regions. First, we have the Recus Femoris, which is the most superficial one here. It originates from the anterior inferior iliac spine. Then laterally, we have the Vastus Lateralis, which originates at the lateral lip of the Linea Aspera. There's the Vastus Medialis, which originates at the medial lip of the Linea Aspera. Then underneath all of those, there's the Vastus Intermedialis. So if we remove the Recus Femoris, we can see it clearly here. It originates from the anterior surface of the thigh. Now, all of these muscles are going to join distally to insert at a common place, which is the tibial tuberosity, through a ligament called the patellar ligament, as you see here. The function of this muscle is forcefully extending the leg as well as flexing the thigh. So that is the Quadriceps Femoris. Next, we have the Sartorius muscle, located superficially, as you see here. The Sartorius muscle originates from the anterior superior iliac spine, and then it inserts at the tibial tuberosity. This muscle will flex the thigh and the leg, as well as externally rotating the thigh and internally rotating the leg. So that's the anterior group. Now let's go ahead and do the medial group. And so let's look at the thigh from a medial view. First, we have the Pectineus, which is here. The Pectineus muscle originates from the pecten pubis, or pecten of pubis, and inserts at the pectineal line of the femur. And its function is both adduction and flexion of the thigh, as well as externally rotating the thigh. So that's this one. Then we have the Adductor Brevis, and the Adductor Brevis, as you see here, originates from the inferior pubic ramus, and it inserts at the medial lip of Linea Aspera. And its function is adduction and flexion of the thigh, as well as externally rotating the thigh, just like the Pectineus. Then we have the Adductor Longus, this one. It originates from the pubic line between the pubic symphysis and the pubic tubercle, and it inserts at the medial lip of the Linea Aspera. And its function is exactly the same as the last 2, which is adduction and flexion of the thigh, and externally rotating the thigh. So that's this one. Then we have the Adductor Magnus. The Adductor Magnus is a very large muscle on the medial side of the thigh, and it originates from the inferior pubic ramus, as well as the ischial ramus and the ischial tuberosity, and then it's going to insert at the medial lip of the Linea Aspera, as well as the medial epicondyle of the femur. Its function is adduction and extension of the thigh, and internally rotation of the thigh. Alright, then we have the Gracilis. And the Gracilis is a superficial muscle here on the medial side. It originates from the inferior pubic ramus and inserts at the tibial tuberosity. Its function is to adduct the thigh, flex the leg, and internal rotation of the leg. So that was all the muscles of the medial group. Take a mental picture, remember these muscles, and let's continue with the posterior group muscles. The posterior group have all the same functions, which is extension of the hip joint and flexion of the knee joint. So they pull the whole leg backwards. Another thing they all have in common is that they're all innervated by the sciatic nerve. Alright, the first muscle is the Biceps Femoris, which is this one. And just like the Biceps brachii, the Biceps Femoris consists of a long head, which originates from the ischial tuberosity, and a short head, which originates from the lateral lip of the Linea Aspera. It then inserts at the head of the fibula. The function of this muscle is flexion of the leg, externally rotation of the leg, and extension of the thigh. where only the long head causes extension of the thigh, since it's the only head that originates from the hip and not the thigh. Then we have the Semitendinosus muscle, which is this one. It originates from the ischial tuberosity and inserts at the tibial tuberosity, and its function is the same. It's flexion of the leg, internal rotation of the leg, and extension of the thigh. Alright, the last one is the Semimembranosus. The Semimembranosus is located behind the Semitendinosus, as you see here. It's larger as well. It originates from the ischial tuberosity and inserts at the medial condyle of the tibia. Its function is flexion of the leg, internal rotation of the leg, and extension of the thigh. So that was the muscles of the posterior group, and that was all the muscles of the thigh. The next video is going to be about the muscles of the leg.